When we first learn that we are going to be a parent, we begin to imagine what it will be like to feed our baby or have meals with our child even before they have arrived. We tend to have strong opinions about feeding our children based on our own experience, plans, ideas, and culture. While we often don't consciously think about it, our cultural background, upbringing, and where we come from affects the foods we eat, the way we feed our children, and when we expect our children will be able to feed themselves. While most children follow the feeding culture of their parents, some children have difficulty feeding or behave in unexpected ways around food. This may be because of prematurity, developmental differences, or medical events, and can cause the child to be unable to feed or enjoy food and mealtime the way the parent expected. This can be upsetting to both the family and the child. A feeding therapist can support the process, but involving a therapist in one of the most intimate activities of your family life can be difficult. You may be wondering, what does a feeding therapist do? How can a feeding therapist help my child? And how often will my child need to see them? Feeding therapists are usually speech therapists or occupational therapists that have additional training and experience in feeding. They may use special tools and toys that are designed for a child's mouth that may look different than those you have seen before. Or they may use what you already have in your home to help your child achieve their feeding goals. You and your child's feeding therapist will work together to help your child gain the skills needed for feeding and meal times. Your child's goals for feeding therapy will depend on the age of your child and what you'd like to work on. Therapy sessions may occur during a typical mealtime, so your child's therapist can observe the meal and provide you with support, or sessions may occur between meals to reduce the pressure and stress of mealtime. How often you see the feeding therapist will depend on your child's goals, who else is on your child's care team, and what they are working on. These are all things to talk about with your child's care team. Be sure to communicate with your feeding therapist and your child's care team to ensure the care they are providing best meets you and your child's needs.